Tell me your full name, please.
James Kevin Fortson,
Could you spell your surname, please?
Fortson.
Mr. Fortson. Tell me your designation, please.
Pardon me?
Tell me your profession, your designation.
I'm a ear, nose, and throat surgeon in Atlanta, Georgia. Um,
And you are also an Army veteran.
yes, I'm retired colonel in the Army, the U.S. Army.
Nice. What years did you serve?
I went into the service in 1981 and stayed until in the reservists until 2016.
Nice. So give us an idea of what happened here today.
I came today to assist Dr. Siraj in a surgery called a balloon sinus surgery. I've been working with Dr. Siraj for several years. We've done several publications and presentations as members of the Caribbean Association of Otolaryngology. I come maybe 2 or 3 times a year to practice with him and do various types of surgeries. Today we had an interesting case where a lady had recurrent problems with her ear and the eustachian tube. We had the idea that using the balloon sinuplasty would help clear some of the problems with the eustachian tube. It helped, but she has some more underlying problems. She's been having problems since early childhood that we were able to identify, and it was a challenging type of procedure.
And just explain to the average person what that procedure entailed.
What the procedure entails is the eustachian tube is a tube that goes from the back of the nose to the ear, and it helps equalize the pressure within the ear. For instance, if you were flying in an airplane and you started descending, you'd have to yawn or swallow to make your ears pop because it forces air from your nose out to your eustachian tube to help equalize the pressure. It can be affected by allergies, it can be affected by infections, it could be infected by other types of ear diseases and problems. And that was kind of what we found out today with this lady.
And why was the surgery so novel for St. Lucia?
Well, the patient has some other underlying problems. She had a recent onset of a upper respiratory infection that made it a little more challenging to get that under control and control some of the secretions and stuff that were associated with that. Then there was some other types of equipment problems and stuff like that that we ran into that made the procedure a little longer than it usually would we expected.
But what made that procedure, why do you think this procedure is so novel for Dr. Suraj and for this hospital?
Well, balloon sinuplasty has been a recent procedure that has come along in head and neck surgery. Uh, we introduced it to the Caribbean a few years ago because a lot of the doctors in the Caribbean had the introduction of this procedure into this region. It was developed in 2010 in some of the hospitals in the States, of which I was a member of the American Academy of Otolaryngology and became interested in it. And since I was working with Dr. Siraj, we wrote a couple of papers and presented it at various meetings to introduce it to the Caribbean.
For you, my final question, what was the greatest takeaway from this surgery being done here with your long-time colleague to the benefit of this patient? What is your one takeaway?
One of the things I think it was is that, you know, that it's a good procedure, but it's not a cure-all procedure. It was a procedure that we found out that there are other types of conditions that affect the eustachian tube and the ear that makes it not a cure-all procedure.
Thank you very much for your time. Tell me your full name one more time.
I'm
Tell
sorry.
me your full name one more time.
Oh, James Kevin Fortson.
Spell your surname, please.
Fortson, Fortson.
Thank you very much, sir.
All right.
Sure.